COVID-19 in New Mexico. Getting better? Getting worse? Let's talk about that. For April 20th, 2020, these are my inferences of the data. Others may have inferences that are different. Who gets COVID-19? Everybody. Seniors, middle-aged, young adults, children. Everyone and anyone can get COVID-19. 70% of the cases are not in seniors. The story is a little different for death. People 70 and over make up the highest percentage of people who die. But look carefully. 50% of deaths due to COVID-19 in New Mexico are people under 70, and a full quarter are under 60, including people down in their 30s. Anyone can succumb to this disease. Certain counties are hit harder than others, but in the Northwest, counties are particularly hard hit. Sandoval, McKinley, San Juan. In large part, that's explained because Native Americans, particularly the Navajo, represent nearly 40% of cases. Here's a graph that we will look at with each update. We're looking at a time frame, roughly between March 11th, when the first cases were identified, even though there were cases before then not identified, through about the end of April. It's important to understand this is a logarithmic scale. Notice that the numbers don't go 1, 2, 3, 4. They go 1, 10, 100, 1,000. This scale allows us to see changes that occur when the numbers are very small and changes that occur when the numbers are very large. The solid blue line with the dots represent actual cases. As of April 20th, we have 1,971 cases. This red line represents the number of cases that well might have occurred had we not had restriction and social distances and closing of businesses by the governor. That was the trajectory we were on. The current projection, indicated by this dotted line, is based on the math of the data points that exist. If we follow that line, there could be 20,000 cases by the end of the month. However, when you look at the last few days, we may be flattening the curve, that is, falling off that projection. If we stay on that course, we might end up with only 5,000 cases. And that also would mean fewer deaths, as deaths follow cases. There are many models, but this is one that is very encouraging. You need to look at the full green cloud, not just the dotted green lines. That cloud represents equal possibilities. Anything within that cloud could occur. A week ago, that cloud crossed the green line at the top. The green line at the top represents the capacity of the healthcare system to deal with COVID-19. A week ago, it was just as likely that we would not be able to deal with COVID-19 cases. Today, if these models are accurate, and they may not be, we have a very good chance of weathering the storm where people with COVID-19 will hit a healthcare system that is not so depleted that people will die simply because they cannot get care. You make the difference. So stay home, save lives. Thanks for watching.